addiction and mental health. And we try to keep town halls focused on the issue. So when we did healthcare, we focused on healthcare. So we like to keep the questions and everything about that. This is an issue that is particularly personal for me. When I was growing up, my uncle, my mother's younger brother, was a heroin addict. And the last time he shot up was actually in my bedroom when I was away for a couple of days. And when I came back, my desk had a burn mark on it from where the spoon and the match were. Because of his addiction, my mother, who is a PhD in clinical psychology, became the head of an organization in White Plains called CAGE, which was the only drug rehab program at that time in Westchester County. That's a heavy-duty job, working on saving people's lives. And so the only way I got to see my mother regularly was after school going to CAGE and spending the afternoon and ultimately the evenings there, when my father would come and pick me up to take me home. So I grew up going to group encounter sessions with drug addicts. I got to know these people not because they were addicts, but because they were part of the program. And I saw those that came back over and over and over again and really tried to change their lives, and those that I became very attached to that simply disappeared and often enough times died. And they were, to me, they were old. You know, they were in their 20s. They were in their 25. They were ancient. But I realize now, looking back at it, just how devastating this illness is. And it not only plays havoc with the person who's afflicted, but absolutely destroys families. And it not only destroys families, but it can break up marriages. It can destroy the relationship between parents and other children. It takes every bit of strength out of you. And that is debilitating. And it's taken an awful long time for government and law enforcement to recognize this as an illness and not just a criminal offense. And although there are still probably too many addicts, too many mentally ill in prisons and jails across this country, including New York, we are starting to make some progress in at least recognizing that that's not the best environment. Interestingly enough, in March of 2018, Time magazine, there's still some magazines out there, dedicated this entire issue to the opioid problem. And I'm just going to read this little bit, what I saw. Like most people, I'd heard about the opioid epidemic. It was especially hard to get my mind around a statistic from 2016. Almost as many deaths from drug overdoses as in all of America's recent wars combined. But numbers are an abstraction. I had no idea what it looked like on the ground. The only way to make real sense of it, I told my editors, was to see what happens to individual human beings one by one. Photography can cut through abstractions and rhetoric to help us understand complex issues on a human level. Never is photography more essential than in moments of crisis. To witness people suffering is difficult. To make a photograph of that suffering is even harder. The challenge is to remain open to very powerful emotions, and rather than shutting down, channel them into images. It is crucial to see with a sense of compassion and to comprehend that just because people are suffering does not mean that they lack dignity. In 2017 or 2016, which he referred to, according to the CDC and the government, nearly 64,000 people died from overdoses in the United States. That's about the same number that die in car accidents every year. It's a lot of people. And most of them are young people. And more of them and I think that's why we get the attention that we do now, are becoming middle-class white people. This addiction has been on for a long, long time, but because of the availability, because it's so easy to get, it has moved from the inner cities, where people were escaping for one set of reasons, into the suburbs and the exurbs, and into rural America in ways that we would have never imagined a couple of decades ago. So, what is the problem? There are so many problems that it's hard to start in one place. But the biggest problem is that we keep trying to do things the same way over and over and over again. New York State this year will allot over $200 million to fighting the opioid crisis. Now we could say, isn't that great that New York is finally putting money behind the opioid crisis? But what it really tells us is that the crisis has gotten out of control, that people are dying everywhere, and the pressure in order to come up with some kind of funding to do something is there. The question is, what will they do with that funding? Will it still go into the same things that are experiencing now? So for example, we know that there'll be more beds in hospitals. That's already admitting that the problem is that far along. It will go into providing medical teams and police with, I can never remember, what is it? Narcan. So if someone has had an overdose, they can be saved. Those are great, but that is already over here. How much money is being spent on this side? The drug program treatments that we have primarily address high school students, if they address anybody at all. By high school, for a lot of people, they're already in a process. They're either drinking or they're smoking or they're doing something. So that process has already started. So where do you have to go to start before the process has started?
Middle school?
Probably elementary school and pre-K. I see. You have to make people aware that there's a problem. You have to talk to parents. You have to talk to educators. You have to talk to the people who culturally impact the society that we live in. Where were we with smoking 20 or 30 years ago? And then it became that smoking isn't good for you, and that smoking isn't a nice habit, and smoking isn't this. And then on the packages, it told you what smoking did. Now, yes, there are still people who smoke, but it's far less than were smoking in the 1970s and the 1960s and the 1950s. And the United States population of smokers is less than in many other industrialized Western countries. That's because we have made a concerted effort to do that. We've made a concerted effort, not necessarily as successful, on driving and drinking. We are now making a bigger concerted effort about driving and texting. We know and understand that in order to have some kind of success, you have to change the culture. And that's where a bigger investment needs to be made if we really want to impact 65,000 deaths in 1 year. If we want to look at how many people have died in war and compare that to the young people who are dying on streets or in their cars or on the sidewalk. And that's what we have to do, and we're not really there yet. So we're still throwing money at a problem and hoping that it will stick, but we don't necessarily have a plan in place that will actually save lives. And I don't know how many people here who have experienced close relatives that have had drug problems, alcohol, heroin, but it's devastating. It's truly devastating. And you begin to feel that there is no way to save that person. And they may want to be saved. But it's really hard. One person in the magazine describes heroin as the person you love most in your life, and the idea of stopping means that you'll never see that person ever again. So imagine, who do you love most in your life, and imagine what would happen and how you would feel if you never saw that person again. That's very powerful. So, I say that this is an issue that the current senator from this district thinks is vitally important, and for that we can agree. But the plan and the funding and the direction is one that I wonder about. Because there is no end when you admit failure. When you say, we need more beds, we do. But how do we reduce the number of beds that we need, which means that we have to start somewhat earlier in trying to change the culture that says that this is something that you do. Why are people trying to escape? What causes the addiction? What are the kinds of things that impact this situation? And until we get there, we can assume, rightly, that this situation will get worse before it gets better. So we have to look at drug companies, most definitely. We have to look at how many pills can be prescribed and what they're being prescribed for, definitely. We have to have the mechanisms for getting rid of medications that we don't need, definitely. But we also have to find a way to increase cultural awareness that this is an illness, that it is preventive, in the same way that we can fight type 2 diabetes, that we can fight heart disease, that we can fight other illnesses that are often caused by our actions. We know that if you eat properly and exercise, even if your body is inclined towards type 2 diabetes and it's in your family, you can still not get it. We know that that's true for some cancers. Lifestyle, activity, attitude, all have an impact on who we are and what we will be. And those are the kinds of things that we need to think about, and those are the kinds of things that we have to introduce at ever younger ages, and to parents, and to people who are planning to become parents. You know, there are a number of people in the magazine that were pregnant and still using. Creates a big problem. Lots of the women in the magazine talk about their children being taken away and never seeing them again. And that loss keeps them in that cycle over and over and over again, because there's really no way out. There are treatment facilities. There are ones that you live in. There are those that you come home to. In Yorktown, there's, what are they called? Sober homes. Of course, there's not necessarily any professionals there. An 18-year-old, I think, died at the one in Mamaroneck or something like that, and it was a lawsuit. In New Canaan, there are sober homes that are $80,000 a month. So I'm sure that all of us are ready to go. In New York City, they can be over $100,000 a month. The one in Yorktown, I believe, was $8,000 a month. So these are not for everyday people. And once again, they don't have professional staff. So really, what is the incentive to staying clean? What is the tools? What are the tools that you learn so that you can change your life and have a better impact on your family and obviously everything else that you're doing in your life? So these are huge problems. These are the kinds of things that all too many people don't spend a lot of time thinking about. And then there's $200 million, and we can say, see, the New York State Senate, the New York State Assembly, and the governor really are doing something about this. But we don't know what the specifics are. We don't know exactly what they're doing or how they're going to do it. So therefore, the problem, most likely, is still going to get worse. Because where's the housing? Where's the health care? Where is the job market? Where are the things that people need to stay productive, healthy, and ingrained and entrenched in the society that they live in without the fears of everything being taken away from them? And I know that there's not one person, probably anywhere, that has not at some time felt like there's a bottomless pit. We all react to that bottomless pit in different ways. But if you are inclined towards addiction, it doesn't take all that much to end you up in a spiral that becomes out of control. So I'm hoping that if elected, one of the things, since I think that healthcare is maybe the top issue that we can do at the state level, benefiting the citizens of New York, that we have to look at this from a medical perspective, we have to look at this from a cultural perspective, and we have to put this together in ways that make it accessible for every citizen, no matter where you live, no matter who you are, so that we can start the dynamic of change so that people do not have to continue through this spiral that has taken so many lives and will continue to take lives until we change on a cultural and medical level.